Welcome to the Women's Empowerment Discussion in celebration of Women's History Month at University Health. This event is sponsored by the Women's Business Resource Group, a division of the ED&I Council at University Health. Our group is an entirely employee-led group, and our mission and purpose is to empower, support, facilitate networking opportunities, share education, and positively influence the culture of women at University Health and within our surrounding community. If you'd like to learn more or you want to join our group, please reach out to me directly. My email address is abbey.gripka@uhkc.org. Today, we'll be hearing from several voices across University Health to lift up and support women of all cultures within our workplace. This is a celebration of the incredible women who have shown up through this pandemic and throughout history by providing healing and hope through healthcare and in the many other roles that women tend to carry. We have Leslie Cardo from Public Relations who will be moderating this discussion today. Welcome, everybody.
Thanks, Dr. Gripka, and hi to everyone who is joining us today. Thanks for being here. The goal is to hear from all of the panelists and all of you. So if you have questions, please make sure you include them in the chat. Comments are also welcome, and we will get to them throughout our discussion today. So first, what I want to do is give you a brief introduction to all of the amazing panelists, and then we'll talk about the following topics. The first topic that we're going to talk about today is what the panelists have observed from women historically and recently throughout the pandemic. We are going to talk about stories of hope and healing. We want to hear what that means for them presently and what that might mean for women's roles in the future. The second point we want to discuss is best ways to both mentor and or sponsor one another throughout our careers. And finally, let's talk about fatigue, burnout, trying to be perfect, trying to be everything to everyone, like so many of us have done for the past 2 years. So let's begin by meeting our panelists. Hyatt Abdullahi is the Senior Director of Community Health Strategies and Innovation. Hyatt develops and establishes new strategies to promote a healthier lifestyle, both for UH patients and surrounding KCMO communities. By building and maintaining strategic community and business partnerships, Hyatt is able to support UH's mission of leading the way to a healthy community and providing easy access to care. In addition to our work here at UH, Hyatt has served communities across the globe as a community mobilizer for the United Nations International Children's Emergency Fund, you might know as UNICEF, diplomatic liaison for the United States Department of State and the Greater Kansas City as a Greater Kansas City representative, a member of the non-governmental organizations, and as a member of non-governmental organizations such as Action Against Hunger and Promoting Global Women's Rights. Welcome, Hyatt. Laura Ashbaugh is the Senior Projects Coordinator in Behavioral Health. One of Laura's many passions is to build up the generation of tomorrow. So glad you're here. She has spent more than 15 years mentoring and training staff to be their best clinically and personally. Cheryl Carney. Cheryl began with UMKC about 10 years ago as a patient access representative for Contact Care, and both here and at the and as a representative for the Assessment, Intake, and Medication, or AIMS clinic. And she went to team leader for LCS to overall BH registration supervisor. Cheryl holds a BA from Baker University and looks to bring other women with her in professionally and in growth. Reverend Roxanne Pendleton, we know from the community for the Center for Trauma Informed Innovation. She is the Senior Behavioral Health Consultant. She's a licensed and ordained minister and a certified yoga instructor, so take a breath with her right now. Roxanne has both a professional and personal experience of trauma, severe mental illness, compassion fatigue, burnout, long COVID, and she's recovered from all of that. She has spent 23 years cultivating resilience in the community settings before joining the staff of UH. So glad you're here. Marquita Phillips. Marquita started at University Health 5 years ago as a senior employment specialist, and in 2021, she was promoted to employment supervisor. She aims to be an exemplary role model who empowers others, particularly her team. I'm sure they're thrilled to have you, and sets goals to strive for professional advancement. In 2019, she won the Job Developer of the Year Award for the Missouri Vocational Rehab Program. That is awesome. Geno Taylor, we teased a little bit before we got it started here, is our lone male representative, but we like the word ally. Geno is an ally. Dr. Taylor, who has his doctorates in education, has worked in the last 6 years as director of quality improvement for University Health Behavioral Health. He has a strong belief in providing mentorship, both formally and informally. And as well, Dr. Weaver, who has her doctorate in nurse practice. She is joining us. We all know Lynette is the COO of University Health Lakewood. She's been in that role since 2015. She's accountable for the day-to-day operations at Lakewood, as well as the Jackson County Health Department. She was previously the Chief Nursing Officer here at UH22C. A lot of you here today, a lot of great voices to hear from. We're going to go to that first question. And Lynette, are you there? I'm going to start with you if you don't mind.
No, not at all.
Okay, great. Thanks for being here.
My
Lynette,
pleasure.
what you have watched on your campus, you've watched long-term care. I think particularly there are a lot of stories of hope and healing there. And you've seen a lot in the last couple of years. Are there stories that stand out to you about hope and healing that you've witnessed? And are they in the last 2 years, or is it the span of your career that sticks out the most?
Well, I've been a nurse for 46 years. So yes, there's stories in that 46 years, but the last 2 years has really been a learning for someone who's been a nurse for 46 years. But in long-term care, those of you who don't know, we have a 188 licensed bed long-term care facility, and we immediately had to lock it down, which meant our residents did not, their families did not get to visit them, and no one was allowed in. And the staff would come to work and they weren't allowed to leave the building or go to the cafeteria for lunch. So we had to bring lunch into them because of the spread of the COVID. And so once they entered the building where long-term care is, they had to stay. And that put a toll not only on our residents, but it put a toll on our staff. And when you look at the acute care side, as you all probably experienced, we had a shortage of staff, and everyone had to pitch in and help. I did baths. I passed trays. I fed people in long-term care. I'm still a nurse. I still have those skill sets, but everybody had to participate so we could take care of our patients and give them the very best care that we were known for. So we had to do a lot of things, and that maybe we hadn't done in a very long time, or it really showed us that we could continue to work together and still provide great care. When we provided COVID vaccine in our atrium in the entrance of that was a whole new world. I gave vaccines if I had to. I took vital signs down there if I had to. We had to open up other rooms because we'd have 800 people coming for vaccines, and we didn't want to turn anybody away. And it was winter, so it was cold. So we looked at different ways for logistics. And so as the chief operating officer, I was in charge of the incident command center, and we would open up at 5 a.m. and we would close around 7 p.m. So my partners during that were Dr. Matt Tinnell, who is our associate administrator of the dental clinic. And at the time it was Carla Wade, who was our ACNO. And we split the hours, but we did 14, 15 hours of keeping the incident command center up. And we would have to troubleshoot everything from PPE to other supplies, getting them there. And that's what we did. And as we learned more and more about COVID, we had to change. But the big thing was supporting each other, and the letters of kindness that came from the community, and the food that poured in, feeding us. And so they put signs out in, if any of you have ever been to Lakewood, we have a lot of property. They put big signs out there telling us how much they appreciated us. And one of my favorite stories, I'll tell you one story, and then I'm sure someone else needs to. We had a brand new first baby mother. And of course, no one could come in except her significant other. Her family stood outside with big signs for 2 days in the cold, wishing her well and telling, even with their dog, they brought their dog. And I mean, they were out there for 2 whole days, giving her support and telling her how much they loved her. We have pictures of it. It was amazing. It was just amazing. And just the community support pushed us forward to just get through those long days. And so the other thing I really noticed among our staff was the guilt between working and taking care of patients and taking care of your family escalated to an incredible extreme. And there were a lot of tears. So just supporting each other and understanding if someone just couldn't do it another day. And I'm sure the rest of you are going to talk about it, but that's one thing that hit. So showing up every day, giving people a hug or just listening to them. My grandson, who's 6, wrote made thank you notes, and I would pass them out. It just little things, just being here and being present. We did start a respite unit for people to go to just catch it was a little room, and it gave opportunity for people to just take a mental break for a few minutes. And we're not used to doing that. We're not. So that was probably the big thing, besides all the guilt of who do you take care of first, your family or the patients. And I really worried how I would feel about taking care of patients who didn't get vaccinated, because I'm a huge proponent of vaccination. And I'm telling you, from the minute I started, I'm lucky my rational brain shut off and my compassion and caring came through. And I didn't even think about didn't even want to lecture. It just automatically came out, and I didn't have to worry about it, but I was concerned about that.
Absolutely. And I think that in the past, correct me if I'm wrong, we don't usually encourage or reward ourselves for those moments of respite, do we? Those aren't things that we don't put that in your resume.
No, we don't know how to do it. So it was interesting that we could begin to give people permission to go just 5-10 minutes, but no, we don't know how to do that. And, it was charged through everything. And so.
Cheryl Kearney, hello, how are you? Thanks for joining us today. Thanks. Cheryl,
Hi.
Did you notice the same thing happening with your team? Did you see that balance of worry between their families and how to support other people? And how did you help get through that?
A lot of it was what Lynette said when she said the families. It was more than just the families, it was themselves, to provide care for themselves and knowing how to say, I need to take time off or I need a break without feeling guilty. You definitely felt guilty anytime that you felt like you needed to take a breather. I can say Roxanne helped my team tremendously because we had people working at home and we had people working on site. Everybody was in limbo. Nobody had ever been through a pandemic. What seemed like hours was running in seconds. We were making decisions, changing the decisions, everything was just running together so fast. And so in the midst of that, we just had so much going on to where we had to ask Roxanne, can you please sit down? Because we were so worried about the mental health of our own client, of our own, our own employees. Here it is in behavioral health, our priority is to take care of our patients. We can't have them come in the door, and we know that our engagement with them sometimes is the only engagement they get. And so for them not to be able to have that, we had to make sure we were going to be able to provide whatever service we could to let them know, you know, we're still thinking about you. We're trying to get you all taken care of. So as frontline, you know, we set the stage for the doctors. We create the experience that you're going to get on the back end. We are the very opening to the community. So when they come in and we give them that warm treatment and we say, we're so happy to see you, it's so surprisingly when you tell somebody, we're so happy to see you, or where have you been? We missed you, how much that means to them, because they don't have people that miss them. They don't have people that are concerned about where they are. And so it was very difficult for the front line to adjust to having, you know, us going telephone video only and making it work.
How do you keep your team motivated, Cheryl, while that's happening?
Because I'm a happy person. I'm always happy. I tell a lot of people ask me, Cheryl, why are you always so happy, or why are you always smiling? And one thing that I always say is I try to be the happiness to a world of hurt. Even if it's just the one little piece of happy, if I can be that one little piece of sunshine that makes you smile, that makes me so happy. I don't ask for anything in return. So many people, well, what can I do for you? I don't want you to do anything but smile. That's all I want. And so I tried to keep my team motivated by constantly communicating with them, letting them know we were going to be okay. And I was actually sent out to work from home. I begged my director, can I please come back? Because I wanted our team to know that they were going to be okay. Because honestly, since it had never happened, we weren't ready for it. My team was afraid every week that was going to be their last day. And we didn't know what was going to happen. You know, we didn't have any money coming in. They had the right idea to feel that way, you know, but we just came in, we struck it out together and made it work. So as I stated, or as in my introduction, I was actually a team lead at LCS. And the day before the pandemic hit, Jennifer Waterman asked me, Cheryl, I need you to come to the healing campus. She just wanted me to work on something down here. Next thing you know, I'm in the fire. I'm making decisions. I'm showing her how we can support working from home. I'm showing her the results of us working from home. I'm pulling numbers, I'm doing everything, and I'm just making it work. And that's when we had an opportunity to present itself for a supervisor, and she encouraged me to apply. She has been my biggest cheerleader in this whole pandemic. And so if I can't say anything else about the pandemic, it has made my team so much stronger. So it's a blessing and a curse. Yeah.
What is that like to have a supervisor who taps you on the shoulder, Cheryl, and says, you can do it? And do you then therefore use that to motivate other staff member and teammates?
That is, so I've always been able to identify other people's strengths and encourage them, much like I'm sure everyone here. And it's so easy for us to get lost in that. And so for me to hear those words of encouragement, I constantly tell them how much it means to me. And I constantly provide that feedback to others and try to encourage growth for them and show them this is something you definitely can do. I have definitely encouraged other people to apply for positions in which they have accepted, as well as our teammates. I've showed them, you know, this would be a good opportunity for you. I spoke with Jennifer and said, this is definitely something, you know, everybody was able to identify their strengths in this and show what they were strong in. And then we started moving everybody according to their strengths. We were able to take the time to see that. Versus, you know, being in the day-to-day, this is what we do today. This was a time for us to really step up, show our strength, and support each other. So it, like I said, it's a blessing and a curse at the same time, because then, like you said, we get lost in, well, how do I take care of myself? I want to be here for my team. I'm secretly breaking down on the back end myself, but I can't let them see that. So how do I take care of myself? And that's where, as I stated many times, Roxanne came in and she supported us so much, and I greatly appreciate her for that.
Your story reminds me of the expression that empowered women empower women, right? All around. I love that. Hyatt, you're up. Do you think, Hyatt, we've watched your team, a lot of news coverage, so we got to watch you guys in action. First, you offered education, then you were able to offer testing, then you were able to offer the vaccine. Was there one of those things that provided the most hope and healing, do you think, to people, or was everything a new wave of hope and healing to patients in the community?
Well, it's all built on each other. And Lynette and Cheryl, everything you said, that was all of us. So with this team, the Community Health Strategy and Innovations team, I'm pretty sure a lot of people heard that, but it is a pretty unique group of people that actually is a unique department to University Health. If you look around, no other healthcare entity has such presence in the community through a team that designated to be the extended arm of the hospital in the community. So we are very fortunate to not only get information out, but be very connected with the community and advocate for our community and bring the information inside as well. We also look at health and community health in general and health education from a global lens. So we're not looking just what's happening here in Kansas City. We're looking at the national stage and also the international stage. So because of the team, that's just not me, it's incredible team that each one of them has always have their pulse on what is going on through the World Health Organization, CDC. So connecting with the community will drive your not only passion, but the way you provide information. We've seen other entities or entities in general trying to do the best they can by telling communities what is good for them. That is not what we do here in University Health or through this team. We connect with partners, we connect with our community from grassroots and through every level. What sometimes we forget is University Health serves everyone and serves a very diverse group of people. And because of that, we have to be diverse with how we provide information. So the healing came from, I would say for us at least, being able to do something about a pretty dire situation. When you hear global health pandemic, and if as you introduced me, I'm pretty involved, globally because my family, I'm not from here originally. My family is from North and East Africa. And contrary to what you see in the news, it's not all just big refugee camp, it's countries that are set and have their doctors, lawyers, and everything. So based on that, you have people that are extremely involved. And because it's different little countries, unlike United States, which is a huge continent, what you do for one country can be utilized or echoed in other countries. So your footprint through the UN or UNICEF or NGOs will be pretty wide. So gaining experience from that helped us here to have that not only desire, but effectiveness on connecting with the community, give them hope so they can give us hope as well, making sure that they know we're here. Is a health pandemic. So this is a healthcare and is teaching entity as well, so going out firsthand, first day, being the first to be out there, connecting with the community, anything that was open. And then after that, having the testing available, and kudos to the hospital for putting the community at the forefront. Having the testing available in the community, it kind of showed our willingness to be on the ground and also be the first to know that, unlike what we were hearing in the news, that in Black and Brown communities will not accept the vaccine. So let's just give it to whoever wants it right now. We knew different because we were, talking to the community. So when the vaccine came and we took it out, we saw thousands of people that came out. So while we were exhausted, because as Lynette mentioned, the hospital was overburdened, and short-staffed, we had to do everything we could through this small team and be able to not cost the hospital not resources, So we had to be extremely innovative, and we were able to connect with our community and be impactful. And that gave us that hope that there's always this is a little light at the end of the tunnel. We were able to see it because we were able to assist the community.
Thank you, Hyatt. Geno, your title is in quality improvement. So what I'm wondering is, how do you come into a group and try to improve quality when everyone is as stressed as we just were talking about? How does that conversation happen, Geno? How do you tell someone who is just given their all and is worried about everything on the home front, how to get things done better? What's the magic in that? What's the secret?
I'm not sure it's any magic or secret. I think it's just simply listening to people. I think if we allow people to speak their truth kind of at the beginning of the process and kind of get all those things that are barriers to improving a process out of the way, what ultimately comes out of there is a robust conversation of how we could be even better. People tend to get really creative when you allow them to speak. So for me, people who know me know that I tend to be quiet. I am quiet because I want to give other people the voice to in the space to share what their knowledge is. I know a little bit about everything, but I know nothing about all things. So I just want people to share. So I just try to give people the space. And once we do that, we ultimately come up with some really great projects and ways to deliver services to our clients that is really great.
Through that spirit of partnership and cooperation, is there any project or any, I'm putting you on the spot here, I apologize. Is there any one accomplishment project, even if it's small, that you thought that wouldn't have been possible if we wouldn't have all listened to one another and shared our ideas? Or is that something that happens on a daily basis?
I am so blessed to be in behavioral health because that's something that happens every day. We are working miracles every day. But specifically in the pandemic, we are normally that group of people who do our best work in person with people. But finding these creative ways to give that same level of care to these people, to our clients when we are not able to be in the same room with them, we found ways to do that. And they just are miracle workers. I'm just so proud that I get to be part of them.
In your bio, Geno, it said that you like to mentor both formally and informally. As we talk about mentorship, is there one that is more effective? Is there a better way to help people, or is it an individual? Is it based on the relationship and the person?
I think it's based on the relationship, and it really depends on the situation. My approach to mentorship is every time somebody asks me whether it's formal or informal to be part of their mentorship team, I first encourage them to write their personal mission statement. And I always share my mission statement with them. This mission statement I carry with me every day. Every decision that I make, I relate it back to this mission. But if I am not fulfilling my mission, then I know that I'm not in the right place. So I ask them to do that. They need to define and know what they want. And once they do that, they can seek mentors that can help them get to their goal. In addition to having that specific mentor, I also encourage people to create a board of directors. We all need this group of people who will tell us the truth always. And I have them here at work who if I go to them, I ask them a specific question. I know they're going to tell me their whole truth. They're not going to sugarcoat it. And I really appreciate that. In my academic work, I have mentors that also will push me to do something different that maybe is outside of my box. I have a lot of different people in my space that I interact with in the community. And so I try to pull people on my board of directors from all different places in my life that I touch. And that gives me the ability to have a robust group of people with knowledge that I can go to when I come across a challenge that I'm not familiar with. And I should say that 99% of the people on our board of directors are females. I have been poured into by females from my upbringing to my education to my career. So I just happen to get all my best knowledge from women. And I appreciate y'all. So thank you.
Do these people know they're on the board of directors?
Some of them, most of them do. If they get a lot of texts and calls from me, they definitely know they are.
That's fantastic. Thank you. Hi, Marquita. How are you?
I'm blessed. Good morning. How's everyone? Sorry.
Oh, no, it's good. It's great to see you. You are finding jobs for people, right? You're winning the award of Job Developer of the Year. You're changing lives. And then all of a sudden the pandemic hits and you think, how am I going to find jobs when everything's working? How do you pivot? How do you keep going? How do you make it work?
Well, so when the pandemic hit, Stacy Truitt is one of our directors, who's our associate director over employment and housing. So with that, the pandemic hit, it's like, now keep in mind, like we dealing with our clients, like Cheryl stated before, with their mental health. And I'm like, I'm having a whole breakdown. Like I'm crying, I'm doing everything. It's like, we do one thing, she's changing the rules. Her and Robbie changing the rules. And next thing you know, I go from dressing like this to wearing sweats and t-shirts. I'm going into Harvesters, we load up the van, we're packing food for our clients, medications. And during all that, I still have clients that I have to be calm. And I had to tell them, they're like, Miss Marquita, I don't know what's going on. I don't know what's going on. So for me, I had, like Cheryl stated again, we had to gather ourselves because they're dependent on us. They calling us all day, every day, texting us, wherever the case may be. But in a pandemic, Miss Marquita, I still want a job. So here we are, 5:08 sometimes. At a certain point during the day, we're helping out our clients who need us. I had to stop, block out like 2 hours, meeting with them or FaceTiming them because they really couldn't come into our buildings. So we're still doing it. At the end of the day, people are leaving their jobs by the droves. At the end of the day, again, everybody's hiring. So even though the city was like quiet, we still, my team and I have not stopped since the pandemic hit. There was no going home for me. I went home for like 2 days. I told Stacey, I cannot work from home. No, my clients need to see me one way or the other. If it's in a parking lot and they just see me, I can't touch them or hug them or wherever the case may be. They see me, sign this paper. Here's the application. This is what I did. I create your email. I put everything, I tried to make it as comfortable as possible without the restrictions. I can't do this, I can't do that. We want to really transport clients for a little bit. But when they had an interview, I was like, Stacey, look, they have to go to an interview. They don't have a way. This is what we have to do. So just me just really stepping my game up even more, just trying to figure it all out. At the end of the day, this is my job to find them employment. So we, over the phone, we did everything possible to make the transition, if that's the right word I could use, into this space of finding in a pandemic, like explaining the procedure. You have to wear a mask now, to keep in mind those who might have schizophrenia or wherever the case may be. So now they're restricted. So we have to talk them through that. This is a barrier, going through the barriers. So it's like I had to just create a space of a happy medium to make sure that they're still successful on the job. And those that were still working, we had to follow up every day, all day. What's going on? Share what's going on. I'm feeling this way. So we had to talk off of that as well. Just being readily available. Like you have to share your story in a crisis that none of us have experienced, but we just have to figure it out every day, all day. So, and I'm proudly to say that I'm proud of myself. I am really proud of myself and my team for just pushing through. When Stacey said, hey, this is what we have to do. You got to go to Harvesters. You got to get food. You got to do this. And then I was like, oh, I can't wait to get back into the office so I can put some clothes on. But that's just me. You know me, I like to dress up all the time. So, but I didn't mind. I did not hesitate one bit. So this is what we need to do. You want to work here? I'm calling stores. I'm calling this. What does it look like? I know it's a pandemic. What are your available hours? So I was still building relationships with employers because at the end of the day, if a client tells me we want a job, I still have to go out to the field and do what I have to do.
I have a feeling that many of us as young girls and boys, were told maybe that we were bossy, but I think that we have that translated, right? I mean, I think that I always say, like, bossy pants, right? You got it done. And I think the fact that you applaud yourself for it is like so great, because I don't think many of us do that. And I think that we all need to applaud ourselves for what we do. One quick question. You talk about mentoring. When you're mentoring someone that you work with or that you know on a professional level, do you find the face-to-face to be as important as it is with a client? If you're mentoring a girlfriend or someone you used to work with, can you do that virtually, or do you still find the value in meeting with that person?
Face-to-face, because you can feel, people know when you're genuine and where you're not, especially in behavioral health. Either they're going to trust you or they're not. If you give off this vibe, like you really don't care about me or things of that nature, they know, or just in general, people know when you're genuine. And so with that, I can feel or see if it's face-to-face. Oh, it's easy to get on the phone or whatever, but I know when you're sincere. I can look in your eyes, if you give me eye contact, things of that nature. So if we're sitting down, and I have clients that know this is what they want to do, and I have to share my own story sometimes just to get clients through, especially women. Like I had 2 kids while I was in college. You could get through this. I had surgery. The next day, I got up and enrolled myself in grad school. When you're goal-driven, you're goal-driven. When you want it, you want it. So seeing them face-to-face and they share their stories, and I said, don't think that this is all, no, I am not a perfect canvas, not at all. So once I share my story as a single mother or whatever, I have 2 boys, and you have kids or wherever the case may be, I know what you went through, but don't make your past be your future. So sharing personal, sometimes your story is not for you. It's for somebody else to, you know how many Cheryls and Laura's and Geno's that's going to come our way? Share your story. Whether it's good, bad, or indifferent or whatever, share your story. Because I share my story all the time. And then they look at me like, what? I say, yeah. But guess what? But I was determined. I was determined to be good at any job that I had. I was determined to be a good mother, be the best mother possible, because none of that comes with a book. None of it. To tell you how to do X, Y, Z, it's trial and error, and you learn. So, and I love meeting clients face-to-face. I don't care if it's somebody not, on my team and they have a caseload of 50 people, whatever, when they come in, I'm like, how's your job doing? How's it going? So the extra support or whatever, I just try to put a name with a face. And then they know like, oh, Miss Marquita cares too. So if Miss Pat or somebody's not here, they'll request me to come out and talk to them. So building that face-to-face, I think is very important, especially if they in a crisis moment or whatever the case may be, the face-to-face and that eye contact will show them that it's people that really care. So I think face-to-face is very important.
Leslie, can I say something real quick?
I was just going to call on you. Go for it.
One thing that we always say in registration when we have, whether it be new patients, old patients, whatever the case may be, we always tell them there is nothing between you and I but this desk. That's the only thing that makes us different. That's the only thing that separates us. We are all the same. We are all walking a story of something. And so don't ever feel, the hardest thing is to come in here. Once you're here, you're here. We're going to give you everything you need. So when Marquita said that, yes, you have to be 100% genuine in this. As Hyatt said, the diversity of patients that we deal with, and they come in and they feel like they're going to look down on me. They're not. No, we all treat each other. That's one thing I love about University Health. I absolutely love that. I'm sorry, I just had to say that real quick.
No, you're fine.
I apologize. I agree. I think we're all one set of circumstances away from someone else's story, right? And the minute we forget that, we're proud of ourselves, and we realize that we're all open to change. Laura, you're next. Thanks for waiting.
Absolutely.
Tell us about your experience. First of all, what have the past 2 years, if you can sum it up, what have the past 2 years been like?
How to sum it up, chaos. But let's be honest, life has always been chaos. It's just a different version of it. I think I was asked to talk about mentoring, and I've heard lots of conversations and discussion about that. And I've always seen mentorship in 2 different ways. One, it's about representation. It's about seeing people who are like you, whether that's they look like you, they think like you, they come from the same place as you, whatever that might be. It's about seeing someone in a different role other than your own and starting to imagine yourself there. And for my own self, something I have struggled with as a woman in a professional role is the balance between professional, woman, and mom. And I think that's a lot of things that women struggle with. My struggle, and I'll be very honest, has been what I have found to be a little different. My husband and I have very non-traditional gender roles. I am the primary breadwinner and he is the primary caregiver. And that is not because I make more, he makes less. It's because I like to be a professional. I like to leave the house and he doesn't. It serves our values, it serves our skill sets. And I really struggled to find women who were also like that. I would meet a lot of women who would say things like, if I could, any moment, I would drop this job and go be a stay-at-home mom. I would do anything to be a stay-at-home mom. And that is great and that is wonderful. And I applaud people, we need that. That is not where I was at. I was at a place where I need someone who says, I don't want to be a stay-at-home mom. I want to be a professional. And how can you do both? And so I think part of mentorship is finding those women, men, and everything in between to really be that representation for what you're looking for, to give you ideas or support or skill sets that maybe you didn't have. And then the other piece I see for mentorship is really about kind of like peeking behind the curtain. We only know what we know. And what we need to know is what we're missing. And when you're trying to look at places to move up, to do something different, if you don't know what that looks like, you don't know what skills or information you need to do that job. I have had many conversations, and I'm a bossy pants lady. My mom called me the camp counselor when I was a little girl. I rounded up all the neighborhood kids and I was in charge of all the activities for the day. So but it's about asking questions. And it's about asking very open and very honest questions. I have been to COOs and I said, I mean this with all respect. What do you do? And I mean that in not that I think you do nothing, but I don't see behind your door. I don't see behind that curtain to understand what your job looks like. So then I don't understand what I need to do and what I need to learn and where I need to grow to be the person behind that door. And so I think that's where a lot of what I have taken from mentorship is looking at what do I not know, who knows it, and who's willing to share that with me. And it doesn't have to be, I think about this in, very like lots of different levels, whether it's team leader to COO, but it's also sometimes, what does it look like to be a counselor? That's a very secret, hidden world because it's privacy and confidentiality. And some people, how do I talk to people? What does that look like? What do you do behind that door? And I don't know if I can do that or not. So it's about giving people that peek, asking those questions, being very open and honest of, I don't know this. And that's a really challenging piece to be able to admit we don't know, and we're asking for someone to fill us in. And so I think with the mentorship relationship, there's a lot of trust. There's a lot of, you have to be very genuine, as Geno was talking about, and you have to know who is going to give you those truthful answers. Like Geno was talking about with the board of directors. I'll be totally honest. I really want to be on Geno's board of directors. I don't think I am, but man, I would kill to be, because I think it's about knowing people and knowing that they're honest and you believe them and you trust them. And so asking those questions, that's the best advice I have to anybody looking for whatever you want to do in life, is find people you're willing to ask a question to. Ask them and listen to those answers. That's really what it's all about.
Laura, do you follow your curiosity? Do you follow your end goal?
That's your question. So for me personally, I sometimes follow curiosity because I'm also a super curious person. But then it's also thinking about what is my end goal as well. I think both of those can be the same, but they also can be different. And it's really about, I want to get here, or I think I want to get here. I've been at those places where I'm like, oh, I think I want that. And then you learn about it and you're like, no, thank you. I don't want. And I remember in graduate school, I had a professor, one of the things he encouraged was intern where you think you want to work, intern with the populations you think you want to work with. Because we all have, I want to work with, I went to school to be a pediatrician. I am not a pediatrician and I do not work with children. And that came from lots of new experiences, meeting different people and seeing that was not a world I wanted to enter. And so it goes back to knowing, Geno used the language of a mission statement. I use the language of values, which is kind of that's the therapist in me, is what are your values in life? What really truly matters to you? Not necessarily your goal. Your goal is what you're trying to do. Your value is your why. Why am I trying to do that? And really getting at the heart and soul of what that is why do I want this? And then where and when can I make that happen? And I think as women, it's important to support each other and grow and share that knowledge and be open and vulnerable and say, you know what, I don't know. I really don't want to go home to my children. They're driving me crazy. I would love to go home to my children. This is hard. This is scary. Being able to say that, to be truthful with people, because it is. And I think through this pandemic in particular, that being, I was one of the ones who went home. And so I had a 5-year-old at home and I had very strong boundaries of this is home, this is work. And I worked really hard on that. And all of a sudden those boundaries fell apart. There was many a meeting. I have probably some coworkers who remember I'm sitting in a meeting, open mic, turn my head and just voluntarily say, where are your clothes? My child decided to be naked in the living room, randomly in the middle of a DBT consultation team meeting. And all of my coworkers laughed and found it hilarious and appreciated and gave grace. And just being honest, like this is hard and this is great and this is horrible. And that's that transparency. Yeah.
I love that. I think also being with a group of people where you can be vulnerable, like you said, and question what your why is and maybe how you got, like maybe you've been told that you should be a certain way, right? And then when you talk out, that's not what the role is that was meant for you. So I think, yes, honesty, you know, like you said, Laura, surrounding yourself with honest people, allowing yourself to be vulnerable, and kind of working towards something is really important. So Roxanne, we're going to talk about flexibility, both, I guess, spiritually and emotionally, but I think of, now that I know you're a yoga instructor, I also think of physically the flexibility. I love that. Roxanne, how have we gotten everyone through this? How are we all doing? What's going to happen next, Roxanne? Where are we? What do we know?
Well, first of all, I want to point out that I am probably the least limber and crankiest yoga teacher you will ever meet. So please do not be intimidated. I say I have to be flexible intellectually and emotionally because I am not limber. So with that, I actually want to pull out a few things that I have heard from our other panelists, because I have 3 practices that I want to encourage people to utilize to deal with burnout and fatigue. And you all have modeled some of this just extraordinarily. So the first one is the practice of being seen and heard and known in a safe and honest and compassionate relationship. I call that process. The first P, process. This is actually something women do naturally. It is one of our intuitive practices. It is the way we're wired. It is one of our greatest strengths. And so let me pull this out. Lynette's stories of her staff being able to be heard and to cry and to take a mental break and to receive encouragement from the community, that is caring for our nervous systems. Cheryl's intentional work to create new strategies to support her team so they could support the patients. Hyatt's modeling of collaborative community-wide caring, where she goes out and listens and brings hope to the place where there's need, doesn't expect it to come to her. That is part of processing in a community. Geno's really wise practice of listening to people, learning about who they are, and then building on their strengths. And his practice of having a board of directors who is honest with him and a place he can go and process. Laura's understanding of the importance of being mentored by someone who gets it, I was clinically depressed when I tried to be a full-time stay-at-home mom. Laura, I don't know if we've ever talked about that, but that was one of the many drivers. So yeah, that and the power of asking the right questions, the powerful questions. So one of the ways we navigate burnout and protect against it and heal from it is to have a daily practice of kind of completing the stress cycle. The stress cycle is chemicals that are bouncing around in our bodies. And we've all been in more fight, flight, or freeze than we've been maybe ever in the history of our lives right now. So just having this space where you can process, where you can be seen and heard and known in a safe and honest and compassionate relationship, that's a practice that is absolutely key for healing burnout and moving through it. And you all have just shared really great examples of that. So that's the first thing I want to highlight. The second thing you also shared incredible stories about, and I want to share a story at the end of this point, which is its purpose, having a purpose. That's the second P. It started with Lynette talking about the things that she did out of her deep sense of relationship. Couldn't you all feel it? Couldn't you, her sense of relationship and leadership and knowing that we've got to care for these people and care for the staff in a way we've never done it. And so she just dove in, right? That's her purpose, being that kind of leader. Cheryl, understanding that your team sets the tone for every single thing a patient experiences at University Health. That's a purpose. Geno talked about his commitment to his personal mission. That gives him purpose. Marquita, wow, the energy, the passion. It is so clear the way she is dedicated to her clients and shares her story, like just puts it out there as a source of inspiration. And then the pride, wow, yes, the pride in saying, I did this and my team did this, and that can sustain you in hard times. And Laura's commitment to remaining curious, following that curiosity and knowing her why. Those are antidotes for burnout. And the story I want to tell you is about a dear friend of mine who is actually an ICU nurse. Many of you may have friends also who've been working in the intensive care units during COVID. And it has been very difficult for them, especially at the beginning when no one knew what to do. And they tried this and it didn't work, and they tried that and it didn't work, and they got better and better and their skills got better and better, but it still wasn't enough. And this friend shared a story with me of a day where she was just kind of in despair. Another patient had died and she was completing her report work. And, these ICU nurses have been working grueling shifts in conditions they never imagined. And the doctors also. All the staff actually. And she become she kind of sunk into a despair, and she was just thinking, what's the point? I learned all this. I didn't know all this at the beginning, and I've learned it to this point, and we still aren't saving the life of the patient. And she was kind of sinking down, and yet she was processing, see that first P, with a mentor who was also there on the unit with her, a doctor. And he said to her, all that stuff you've learned, you didn't learn it for that patient who just died. That patient who just died helped you learn it because it's for the next patient. And just that sense of renewed purpose, like nothing is wasted, And I personally believe that each of us was born for such a time as this. Y'all, it is a hard time to be alive on planet Earth. And maybe it's never been easy. Maybe it hasn't, but right now it feels really hard. And sometimes it's easy to get overwhelmed and think it's hopeless. And when you get that way, I want to encourage you to look in the mirror and say, and that's why I'm here. This is really hard, and that's why I'm here. At this particular point in time, in this particular position, in this particular family, in this particular part of the country. I mean, you know how many times I wanted to move outside of the state because of some things that the state leaders have done that I am ashamed of? And then I'm like, no, I need to be here, bringing whatever it is I'm bringing, compassion, a sense of, solidarity to work for justice, whatever it is. So if you can find regular places to process what you need, what you are going through, help your nervous system in that way. And then if you can remind yourself of your purpose, those are going to be protective against burnout. And then the third and final thing I want to point out, the third P, is protect. Y'all, we protect everybody. We have that fierce mother bear energy that can come out of us, and we will fight to the death, right? And we all say that we want the world to be a better place. We want the world to be to have more kindness and more goodness and more health and more joy and more equity. And I would just like to remind you right now that you are part of the world. And you deserve more kindness, and you deserve more goodness, and you deserve more equity, and you deserve more love and happiness and joy. And so, because it is so natural for us to do it for others, we have to find ways to do it for ourselves. Because I haven't noticed anyone in line outside my door saying, I'm going to sign up to protect you today, Roxanne. Even when we're sick, even when we're tired, right? So find ways to protect yourself. And there are 3 ways I would suggest here as we kind of sum up. Rest. You got to find ways to rest the body, the mind, the soul. Give yourself compassion. There's a way to do it that can completely reset your nervous system. There's a mindful self-compassion practice that I'm actually going to, I'll put it in the chat, but it's also going to be sent out by Abby later. There's a self-compassion practice. It takes just moments. It can really help your nervous system reset to a calm place. And then finally, protect yourself by setting boundaries. What will you do right now? What do you need most right now? What can you say no to? What can you trust someone else will do? Because you don't have to do it all. So resting, giving yourself compassion, and setting boundaries for your time, for your energy, for your thoughts. What kinds of things are you not going to let into your mind? Those are ways to care for yourself when you are fatigued, and whether that fatigue is compassion fatigue or long COVID fatigue, or being a mother fatigue, or being a community activist fatigue, or being a leader on your team fatigue. Figure out how to give yourself the compassion you need, how to rest, and how to protect the incredible, important energy that is you, because you were born for such a time as this.
It has been an incredible honor to be able to share this afternoon with you guys. You are, love it. We should do this every afternoon. This is so good for our soul. I seriously think that we need to fill each other back up, right? And you have all filled me up. So I hope that you have all left or are feeling restored and honored and appreciated, and get to pat yourself on the back for saying you are here for this time. And it has been an honor to share the afternoon with you. Dr. Gupta, if you want to give us any final words as an organizer, I'm going to ask if you want to. You are more than welcome to do it now. If not, thank you all. And there you are.
Thank you all. That's all I got to say. Keep on keeping on, everyone. We're doing a great job in this crazy world, and we just need to support one another. Thanks for coming.